very much, Les Concorder. Well, I too welcome this bill, and as Ireland ranks lowest among OECD countries in its ability to link and access data, I suppose this health information bill represents a critical step towards modernising Ireland's healthcare system by providing a legal basis for digital health records and facilitating the sharing of patient data. The bill aims to improve patient care and align Ireland with international standards. I suppose this is one small cog in the wheel, and it's very important, but there are so many other things, and it's heartbreaking, Minister. I too, like everyone else, have been over in the AV room with the scoliosis patients, and it's terrible to see, the neglect, the way they have been neglected. And I sat here in front of your leader, Micheál Martin, who is now the Taoiseach. He was Taoiseach at that time in 2022. And he promised me that he actually got cross to me when I raised it against you. When was the 5 million going to be made available? 5.1 or 2 million, I think we were talking about that day. And since then, we've had terrible cases like in Kerry, Liam Quinn, who was waiting and waiting and waiting and waiting. And gladly last June or sometime like that, he did have his operation after so many false dawns. And it's great to know that he's improving a little bit, and the difference that operation makes to him. They can eat, and he's improving daily. We shouldn't let any of these children, and they're over there in the room, suffer any longer, and make sure. I'm asking you to make sure, and I know that Taoiseach and the Taoiseach and the President and Eamon Ryan, all these are over around New York, but and somewhere else, but it's here in that room they should be today. And that I make no apologies for saying that. And I know it is hard for people to divide that time, but that they need to see that, and I'm asking you to make sure that they see what happened here inside in this AV room today. I myself had occasion last weekend to be in a hospital with one of my very good friends who took ill. And I see what the nurses are going through and the way they're writing everything down, and it's wrote down double and triple, and like on top of caring for the patient, the way they meticulously take data down about the patient, and such as there for the next shift or whatever, or for the next doctor to see. Any way that could be speeded up, and any way that maybe you don't have to be a nurse to take down those records. That's what I'm trying to say. There should be clerical staff there to help the nurses, because in the middle of the night, Minister, in the middle of the night, them nurses are working alone and trying to take down the data, trying to mind the patient, trying to mind the people that are with the patient, and trying to see that the doctors come in time or whatever. They're under savage pressure. And any way that would improve the data taking down that they have would be very helpful. And I'm asking you to look into that as well, because it's very, very important. And the other thing that I'm concerned about is the way data, there's breaches of cybersecurity, whatever risks. I wonder about that, and if patients' records could be compromised or obliterated. With something like this, I still think there's need for something to be written down as well, to ensure that we can go back if something like that happens. And of course, the patient or the family needs to give their agreement and written understanding to that, to what's happening.